Welcome to the CURES Show, where we explore the cutting edge of wellness. So many of us suffer from migraines, and to treat them can be confusing, from harsh drugs to natural remedies, lifestyle changes. So really, what causes them, and what's the latest in how to make them go away? The answer is actually all can be very personal. So I'm excited to have Dr. Joseph Maroon on the show. He is a neurosurgeon who specializes also in the treatment of migraines. Has certainly treated many as the team neurosurgeon for the Pittsburgh Steelers back since 1981. He says migraines commonly also go hand in hand with concussions. So we'll get into that as well. Welcome, doctor.
Thank you so much, Karen. Great to be with you.
So what really causes a migraine? As a neurosurgeon, I know you know exactly what our brain looks like. What's happening when we're having a migraine?
Well, what happens is there's a hyperexcitability state in the brain, and various neurochemicals are released that causes alteration in the cerebral blood flow in the brain. And the constriction of the blood vessels usually can lead to intense, throbbing, sometimes intractable pain in the head. It can be unilateral on one side, it can be bilateral. Oftentimes it starts in the cervical area and goes forward. It can be associated with tearing. It can be associated with increased urination, vomiting. And it really affects 15% of the population of the United States, and actually is one of the most debilitating neurological disorders in terms of work loss, family interference, and incapacitation.
So as someone who would suffer from that, and I know there are many people here in the newsroom, step one is you really want to learn what your triggers are and avoid them?
Exactly. And that's a very important point. So that it's often triggered by various food substances. It can be wine, cheese, nuts, also food additives, things that you're not aware of that you're getting in your food can also precipitate it. Glutamine in Chinese food can also do it. So and barometric pressure, changes in the weather, and the barometric pressure can lead to prodromal symptoms like fatigue and tiredness and even depression, mood disorders that gradually cascades into a full-blown, intense, throbbing, painful headache. And it, as I said, it's very disabling and very common.
Yeah.
And there's a genetic component to this as well. If your one parent has it, you're 40% likely to suffer from migraines. If both parents have migraine headaches, it's up to 70%. So choose your parents well, Kara.
Right. So that's one of the things we can't control, but we can control some of the other things like common triggers. And I guess that could be different for everyone. But you also say that for a lot of people, cheeses, red wine, and nuts could be a trigger.
Yes. And it's important to keep a food diary, to be cognizant, to be aware of what is associated with the onset of the headache. If it's certain foods, try to avoid them. If it's alcohol, obviously. One of the most common things that's hard to avoid is stress. And stress is a trigger. And it's interesting that 21% of people who are unemployed have migraine headaches, compared to 15% of the normal population. So unemployment leads to stress, leads to migraines and other problems.
I mean, it's one thing we talk about all the time on CURES is the mind-body connection. So though you have a traditional background as an MD and a neurosurgeon, you are here to say that doing yoga and breathing and minimizing our stress and anxiety is crucial in managing our migraines?
Absolutely. I actually wrote a book entitled Square One, A Simple Guide to a Balanced Life. And in it, I emphasize just the things that you mentioned. I emphasize physical activity and exercise, which clearly has a mitigating effect on the development of migraine headaches, and also controlling stress, meditation, prayer, religious activities, and focus outside of your body. You know, we know, Kara, that the mind can make the body very sick. Ulcers, irritable bowel syndrome, heart attacks. But the corollary is also very true that I discuss in my book, that the body can heal the mind. The exercise that we do, aerobic, stretching, weightlifting, easy weights, also releases neurochemicals, neuropeptides that actually create new brain cells, connect, make new synapses in the brain where the brain cells are connected, and enhances what we call neuroplasticity, the ability to take diffuse amounts of information like we're talking today and convey it in a coherent manner. So exercise has all of those benefits.
So one of my desk mates here, she suffers from chronic migraines, and she's gone to great doctors, and she's worked on lots of things, and she still suffers from them, though they're more under control. Is it something that when we are one of those people, we're always going to have to deal with a migraine?
Well, again, I go through a stepwise program. I'm very holistic, despite being a neurosurgeon. I'm very holistic in my approach to problems like this. And when I say holistic, usually I start very easy in terms of drug administration in patients with almost any problem, be it arthritis of the neck or back or migraine headaches. And by easy, I mean usually most patients will have recourse to aspirin, ibuprofen, Tylenol. All three have very significant side effects that can be very dangerous. I start with magnesium. 50% of people are deficient in magnesium who have migraine headaches. And if you go to an ER when the headache gets so terrible that nothing can be done to relieve it, the first thing they'll give you is IV magnesium. And this will break the headache in up to 50% of the cases, if not more. So magnesium is one of my first go-to elements. And people who exercise a lot, it's often deficient. And really 50% of the people don't get enough of ionic magnesium in the country. The other is riboflavin, vitamin B2, particularly for migraine. Vitamin B2 has an anti-inflammatory effect. It also enhances mitochondrial function, which are the organelles in every cell of our body that takes oxygen and glucose and makes ATP or energy. And the other product is feverfew. This is a product derived from a plant, and it has chemicals in it, natural chemicals, that have been shown in very good studies when it's used for migraine to reduce the incidence and also the frequency of migraine by up to 50 to 75%. So those are the kinds of natural, holistic things that I prescribe. After that, there are various drugs that are administered that we can discuss.
So I want to talk about the drugs in a moment, because I know they have been really game changers for some folks, especially some of the newer ones have come out. But back to, I know people are going to say, okay, how do I take this? So magnesium, riboflavin, and feverfew. If someone wants to go to their local Whole Foods or health food store, how would they take this to see if it helps them?
I think you can Google those three products, and options will come up as to where to purchase it. It's relatively inexpensive. It's natural. There are no side effects. And it's the first thing that I recommend, those three products together for my patients.
Are there certain doses that you like?
Well, doses, the magnesium is up to 350 milligrams a day. The riboflavin is 400, and the feverfew is what you get when you order it. So that they're prescribed. The formulation is well tested. It's been available for over 25 years, and tens of thousands of people have found it effective.
Yeah. And so you have found in the background that you sent me, Akiso Health Sciences is also a resource. I'm not sure exactly. Is that a company that creates these supplements, or?
Yes.
Okay, so that's one that you recommend?
Dietary interventions. The ketogenic diet is something that I've written about relative to the treatment or the ancillary treatment of patients with cancer. a high-fat, very low carbohydrate diet, less than 50 grams a day. This is a diet that actually it creates weight loss done appropriately. That, as well as intermittent fasting, sometimes can be therapeutic. So all of these things need to be done in concert.
Yes, as you're talking about holistic treatments, it's a holistic, we're treating our whole person. Just to comment before we move on to some of the prescription medications, the ketogenic diet, I imagine as a neurosurgeon, people can get very confused about that. You might want to work with a good naturopath, but you're not talking about going out and eating a lot of red meat or filling up on the wrong fats. You mean healthy fats, correct?
Exactly, healthy fats, avocados, nuts, natural vegetables and fruits, and kind of be careful about the fruits in terms of the glucose content if you're going to do that, but also essential. And then your vegetables and nuts. These are all
unless
healthy.
Nuts are a trigger,
fats.
Right?
Pardon me?
Unless nuts are a trigger for you, and then you don't eat them?
Excellent point.
Okay.
Very good.
Is chocolate a trigger?
It can be for some people. However, there's a recent study out of Harvard called the Cosmos study in terms of looking at high flavanol and high cocoa chocolate, which is quite therapeutic. It's quite healthy. It actually helps to enhance longevity as well as lifespan and health span in the right doses and taken regularly. So flavanols that you get in blueberries, blackberries, strawberries, things like that are also potentially therapeutic.
One of my favorite things, berries and some dark chocolate. So you can make it enjoyable too. What should one do if they feel a migraine coming on? Is there anything that really works to kind of ward it off at that moment?
Well, that's, again, most people early on will take ibuprofen, Tylenol, and the products I mentioned, magnesium, riboflavin, and feverview. These are things to abort it. And then there are various drugs that can be prescribed that also can abort it, taken very early on. Ergot derivatives, serotonin enhancers, and then the calcitonin gene-related peptide drug, which is a mouthful, but these are antibody products that block the particular peptide that's thought to result in the hyperactivity of the brain and the nervous system that results in the migraine attacks. So again, once you get beyond the natural products, it's consultation with your doctor,
Right.
your neurologist, who may specialize in headache control to get the most therapeutic benefit from medications.
Yeah, and I know we actually have, here in Connecticut, Hartford Hospital has a migraine clinic and a headache center. So there's places to go where people can get some help with this. But talk a little bit about these drugs. Some of the ones that people might know by brand names, because I know a few people around the newsroom even were saying they take them, they've been game changers for them.
Yeah, well, the drugs I mentioned, the calcitonin gene-related antibody, the monoclonal antibodies, and these drugs have been compared. The other product that is used frequently for migraine is Botox.
Okay.
Botox injected into the posterior cervical muscles, and these antibodies have been compared with the Botox treatment and found to be superior to Botox. But that's another thing that's commonly recommended now by physicians for migraine treatment.
So is that because we might be chronically tense back there? So when we're relaxing the muscles, it's going to help with the migraines?
Yeah, that's exactly right. And it's important to differentiate between tension headaches and also migraine. Eye strain, sitting in a position for a long period of time, cervical degenerative arthritis, all can cause the muscles in the back of the neck, the trapezius muscles, those that attach to the base of the skull, to go into spasm. And when they go into spasm, they can promote pain over the greater occipital nerves, which are in the back of the head, and they go forward, so that you have not only a neck pain, but also an intense headache. But these are usually, they're precipitated by stress also, but not by food products, not by barometric pressure generally, but mostly by stress. And they're not usually associated with photophobia, which is sensitivity to lights, or phonophobia, sensitivity to sounds, or even some smells, some odors, fragrances can precipitate a migraine headache. And that's why companies now, large companies, have literally built migraine rooms, which are very quiet, dark, and without any fragrances of any kind. So patients could literally, when you have the first sign, decompress, take it easy, lie down, relax, meditate, and don't stimulate your brain through your sensory organs any more than you need to.
So the connection there, so that we all understand it, is that people who suffer from migraines tend to have a hypersensitive nervous system. So the idea of just really getting into that calm state and removing all those distractions will help us to calm the nervous system, and that can really help. That's the connection?
Yeah, that is what you mentioned earlier, the mind-body connection. And we have the so-called limbic or emotional brain, our limbic system in the brain, the inner rind of the brain, which is the repository for fear, for anger, for all negative and positive feelings, mad, sad, glad. And when we have stimulation, particularly of a stressful nature, it also connects with what we call the autonomic nervous system, which is the nervous system that controls our breathing, our gastrointestinal function, our heart, our lungs, and also innervates the blood vessels of our brain. So there's a very direct connection between our emotional brain, our limbic system, the autonomic nervous system, and subsequently the reaction to the blood vessels of our brain, and also the muscles of our neck, our back, our body. Yeah. So again, stress is a very deleterious factor. And again, diet, exercise, controlling environmental toxins in terms of alcohol, drugs, controlling stress, and getting adequate sleep. Sleep is a critical part of the whole thing.
So let's talk about Nurtec for a moment. I know that I've done some interviews on that, and I know there's some folks here who say that that's been a game changer. Other drugs didn't help them as much. Can you help people understand what Nurtec is and your thoughts on that?
Neurotech is I think you're referring to the external electrical stimulator that actually, I mentioned the sympathetic nervous system, which is fight or flight. There's the parasympathetic nervous system, which is rest and digest. So when we meditate, what we're activating is the parasympathetic nervous system, and it works through the brainstem, the vagus nerve that goes to our body, most of the organs of our body. So what these electrical stimulating devices do is they stimulate the vagus nerve, which is right next to the carotid artery in the neck, and actually slows the heart rate, slows the digestive system. It activates the parasympathetic nervous system. When we meditate, what we're doing is we're activating the parasympathetic nervous system to calm our body, to relax. So what these electrical devices are doing is putting us in a meditative state physiologically without meditating.
Okay.
You get that?
Yeah. No, and I was actually meaning Nurtec as in Nurtec, but I wanted to let you continue because that might be another treatment. But Nurtec, is that a class of the drugs you're talking about? That's the every other day. A lot of people are now a newer migraine drug, but they're taking it every other day just to prevent them. And some of the people I've interviewed have said that their migraines have nearly disappeared since they've started taking it. I don't know if it's for everyone or what your thoughts are.
Yeah, well, I think it's in the calcitonin gene-related peptide drug group. And I think, again, these are very expensive drugs. So when everything else fails, you know, whatever works, you do.
So that's something that obviously we just need to talk to the doctor about. But is there, do women get migraines more than men? Is there something about our genetics as far as?
Yes, yes, there is. Women get significantly more migraines than men, except before puberty. Before puberty, males have a higher incidence of migraine than females. But generally speaking, women clearly predominate in the statistical area of that.
So when you mention uncontrolled anxiety can really fuel a migraine, we've done a lot on this show about getting the proper treatment for mental health conditions like anxiety and depression, which have certainly gone through the roof since the pandemic. And we want everyone to do the lifestyle things as well, but sometimes you might need a medication, and perhaps your doctor is going to prescribe something like an SSRI. If you get your anxiety treated, is it possible then that your migraines might go away or dissipate from taking the anti-anxiety medications?
Yeah, I mean, there's clearly a relationship, and it is a medication that is frequently prescribed in these particular situations. And again, unfortunately, we don't have a cure for migraine at this point, and that's why there's a whole panoply of drugs and things available. But clearly, whatever can be done to reduce stress. And depression is another common precipitating factor. The most effective drug, in quotes, for depression is aerobic activity. And this has been shown over and over again in stress in patients who have been depressed, who have been given an SSRI, and others who have been put on a regular exercise regimen. And the exercise regimen works more effectively, longer lasting, and obviously no side effects compared to drug therapy.
Mm-hmm. And again, it doesn't have to be crazy. It could be some brisk walking every day. So we don't have to get people start where they are. So yes, the exercise being very important. Back to the supplements for a moment. You also have done a lot of work with the connection between concussions and migraines. This is a big deal, especially for parents, because so many of us have kids in sports. And I know I've had to take both of my kids for concussion treatments. But talk about the relationship between concussions and migraines, and how sometimes you also like to prescribe omega-3 treatments.
Yeah, absolutely. Well, the so-called post-concussion syndrome. Most concussions, patients who have concussions, particularly from sports, are better in 2 to 3 weeks, maybe 4 weeks. The majority are. There's a small percentage, 5 to 10% or so, who continue to have the symptoms of photophobia, of headache, of memory impairment, of emotional lability. And in these particular patients, again, I go through the same regimen. We're talking about diet, exercise, rest, gradually getting back into their activity level with supplemental magnesium, riboflavin, omega-3 fatty acids, fish oil. I'm a big proponent of fish oil as a natural anti-inflammatory. We actually wrote a book on that, Fish Oil, the Natural Anti-Inflammatory, and its effect on prevention of cardiovascular disease, enhancing brain health, cognitive health, and also I use it in place of ibuprofen for arthritis. And we've read another paper on that, the use of omega-3 fatty acids for arthritis in the right doses. And for concussions and headaches, it's a very recommended project as well.
Word of caution, you want to make sure, we've done other shows on the importance of getting high quality. You don't want the kind of fish oils that may have something that would be bad for you. So making sure you're getting high quality without the mercury, without fillers, making sure Nordic Naturals might be a good common brand that people could find that's well tested. But you want to make sure people aren't just going and getting anything when it comes to fish oils.
You're exactly right. Nordic Naturals is an excellent brand. Barry Sears has an excellent product. These are all micro distilled and from fish that are appropriately sourced and then encapsulated so that they don't have exposure to air until they're taken. So these are all important criteria.
And you know something a little bit about also preventing aging, which I know we're talking about migraines, but this is all related to, we all want young brains. So all of this stuff is going to keep us young as well, whether we're helping with our kids, with their sports, but all the other things, the meditation, the exercise, the eating right. You are a veteran, I heard, of 72 triathlons and 8 Ironman triathlons. So you actually do practice what you preach, correct?
I practice what I preach, and I also, I'm a big proponent of hyperbaric oxygen therapy, and have written a few papers on that as well, and given quite a few talks on the benefits of that in terms of post-COVID, long COVID, post-traumatic concussions, and also stroke. But that's a topic for another day.
Yes, we'll keep it to migraines for now. But we've only got about 2 minutes left before we're going to have to end. And I want to let people know they can, you've written many books and they can find out more at your website, josephmaroon.com. But before I let you go, there's a lot of talk. Women are finally learning a lot more about perimenopause and menopause and the fluctuating hormones and what it's doing to our health. Is that a time where migraines could be triggered if you haven't had them before, or would there be a connection?
Yeah, no question about it. There are many women who have migraine headaches in the perimenopausal period and also in the perimenstrual period. It can be associated with menstruation and come on a monthly basis and be fierce. So yes, there's a hormonal connection as well as genetic connection, an environmental connection in terms of food, so that all of these things, like the Buddhists say, you have to be mindful and aware of the relationship, and then do your best to mitigate them.
So as we sum it up, to mitigate, we want to make sure you keep a food diary. You might notice some trends about, gosh, I'm always getting migraine around this time, and by writing it down, you're going to see that pattern. You want people to exercise and really work on the stress reduction for meditation, and going back to those 3 supplements, the magnesium, the feverview, and the riboflavin. Those things can really make a big difference.
You summarize better than I could, Kara.
Yeah, well, I like to give people a checklist at the end. If you've been listening and watching this far, that's your checklist, right? Anything else? Any final thoughts, Doctor?
No, I think you've done a superb job covering the topic.
And if you were going to recommend a book, I know you've written many, but a book that people might want to read?
Square One, A Simple Guide to a Balanced Life, on Amazon.
And that's written by you, sir, correct?
Yes.
Okay.
Sanjay Gupta said it's already changed his life.
Awesome. All right. Sanjay Gupta, of course, from CNN, often on our airwaves as well. Dr. Joseph Maroon, thank you for taking your time to share some really important information about migraines. We do appreciate it here on Kara's Cures.
Thank you for the opportunity, Kara.
And you can follow me on social media at Kara Sundlin for more information on the cutting edge of wellness. Have a great day and be well.